Hello, my name is Melissa Jones, and these are my two audience members, Ashley Campbell and Hannah Jones. Again, my name is Melissa Jones, and this is my persuasive speech on policing the mentally ill. Suicide by cop is a method in which a suicidal individual deliberately behaves in a threatening manner in order to provoke a lethal response from a public safety or enforcement officer. The nature of these volatile encounters creates a dire need for specialized police training to identify mental illness, diffuse dangerous situations, and provide the proper resources to ensure adequate resolutions. According to the Police Executive Research Forum, in at least 51% of these cases, there were indications of mental illness. Suicide by cop reinforces the need for proper coaching, as well as addressing the problems that people face suffering from mental illness. While people who have a mental illness do not always commit a violent crime, when a person is in a mental health crisis, their loved ones often seek help through 911 services. Policing the mentally ill has become one of the toughest challenges facing police departments across the country. When de-escalating a volatile confrontation involving a mentally ill individual, officers juggle the dual roles of enforcers and social workers. Mental health resources have seen significant budget cuts in recent years, and the officers frequently become the first responders to situations complicated by mental illness. In turn, police officers become responsible for not only enforcing the law, but acting as accidental mediators. According to the American Psychiatry and Law Association, 90% of officers on patrol have an average of 6 encounters with mentally ill patients in 1 month period. People suffering from mental illness can struggle with adhering to specific commands or following directions, and this can give the officers the perception of resistance. Without adequate training, the situation can become explosive. For incidents like suicide by cop, officers should have the necessary tools to resolve the conflict peacefully without using deadly force while keeping themselves and the public safe. Another study by the Executive Police Research Forum indicates that 67% of suicide by cop cases had a confirmed or probable mental health diagnosis, including 19% with schizophrenia, 16% with bipolar disorder, 14% with depression, and 38% have prescriptions for mental health medications. These numbers reflect the demand for appropriate education, such as using the correct verbiage to interpret the person's thoughts and actions. And for an officer to respond adequately, they need to know what type of events are unfolding. With effective communication learned in training, officers can resolve most conflicts peacefully. The number of people with mental illness committing a crime and entering the judicial system has sparked the need for policy reform. The justice system has a responsibility to regulate crime accurately and provide public safety. That can become tricky due to the complexities that mental illness brings. Focusing on specialized officer training in a clinical and therapeutic direction could dramatically improve the way law enforcement safely interacts and connects with these people. This implementation could steer more people away from the criminal justice system and into the help that they need. Such an approach has resulted in the creation of the Crisis Intervention Team, or CIT. Essential elements of CIT believed to enhance police response are specialized training of officers, usually around 40 hours, forging law enforcement partnerships with mental health community services, and shifting police roles and organizing priorities. CIT training focuses on the explanation and the treatment of mental illness, communication and de-escalation skills, and the classification of 911 calls. CIT training necessitates a commitment from community and an agency partnership, as well as full backing from police department leadership. It can be difficult to achieve unity and open-mindedness, as well as acquiring the budget and resources needed to facilitate this training. CIT, while in its infancy, can be successful, but it comes at a high cost. A successful model for CIT training in a large city could cost an upwards of $2 million and require budget cuts that take time. While training can be a positive resource for the police department, it can be meager at best, does not cultivate long-term relationships between mental health organizations and police departments. It's also hard to incorporate the time needed for extensive training. For big cities like New York, some would argue that mentally ill-related crimes only represent a small number of incidents and do not pose a higher threat to officers or the general public. However, in a climate such as we have today, between a divided nation, health resources taxied with COVID-19, and economic strife, the need for swift and proper police training is at a fever pitch. And here are some profiles, according to the Washington Post, of suicide by cop subjects. Most of them were male, about the age of 35, 41% were Caucasian, 26% Hispanic, 16% African, 37% were single, 29% had children, 54% were unemployed, 62% of men had confirmed probable mental illness history. How to police the mentally ill is a question facing the justice system in America. CIT training for police officers responsible for controlling and maintaining public safety is paramount to combating the strain that is placed on the officers. Mental health resources cannot be held solely liable for bearing the weight of handling people who have a mental illness, primarily due to the encounters that officers face during their shifts. Suicide by cop is a prime example of the unpredictable contact that these police officers face. Preventing criminal behavior, possibly detouring of overcrowding America's prison system, and attempting to get people suffering from mental illness the help that they need can be a positive result in more specialized training for police officers. While concerns for budget and policy change required to implement the programs necessary to incite this progress can be challenging, however, with communication and unified resources, the change is not only possible but highly beneficial for all parties involved.